Hey guys, so we're going to go over pathologies and cautions. A licensed massage therapist can play an important role in helping alleviate certain symptoms and improve overall comfort during pregnancy and postpartum. However, all customized massage treatments need to be tailored to that individual's specific condition or pathology, so how it's presenting in that individual. So let's go over a few of the pathologies that are common during pregnancy. First one is GD, gestational diabetes. So massage can help with circulation, can help with relaxation, but you should probably avoid too much deep or intense pressure. So just focus on more gentle techniques, kind of err on the side of caution there. Other considerations, you can monitor for any signs of hypoglycemia, low blood sugar, especially if mom hasn't eaten in a while. Maybe offer her a little snack afterwards if her blood sugar is a little bit low. But mostly this is common enough where you can ask mom, how did this present? How are you managing it? And most of the time they've got a handle on it, in my experience. So just make sure that you chart it, you're aware of it, and you know how to adjust around it. Second one, preeclampsia, okay? Avoid deep tissue work and any techniques that could exacerbate the condition, such as extensive lymphatic drainage or any strong pressure on the back and legs. The therapist should be aware of high blood pressure and swelling. This is a condition where we basically want to help reduce stress and provide comfort. Just always be cautious with this condition. Seek clearance from the doctor if you feel like it's outside of a scope of practice for you, it's outside of your comfort zone. Another thing with preeclampsia is that sometimes mom will say that she has consistent pain in the upper right quadrant of the abdomen, the epigastric here on the right. And sometimes that's just baby kicks. Baby's feet are sometimes kicking the ribs, but this is also where the liver is. And preeclampsia affects the liver. And so quite often there's high blood pressure as one of the markers, but sometimes you get some pain in the liver as well. So the combination of things that might be reported, but quite often this is something that is managed by the OB-GYN or midwife or birth team on the medical side of things. And you as the LMT just need to be aware of how this can present and know that the biggest thing with it is that it is high blood pressure. Just treat it as if you would treat any other client who has high blood pressure. So again, just no deep tissue, nothing too intense, maybe use less heat, just scale back and keep in mind that our primary goal at all times is to give this individual some ease and comfort in their system. Okay, the next one, hyperemesis gravidarum or HG. I'll say that again, hyperemesis gravidarum. This is where mama has not just morning sickness, but she's throwing up to the extent where she's not getting the nutrition or hydration that her body needs. So this is actually a really big deal. Again, most of the time they are under management through their primary care provider, whether that's a midwife, a CNM, or that's a certified nurse midwife, CNM, or OB-GYN, whoever they're seeing for their primary care. Most of the time, if it's hyperemesis gravidarum, they're very aware of it. They usually bring it to their doctor right away, and usually there can be prescribed a number of things. There's Zofran, which is like a little dissolved thing that goes under the tongue. There's a number of things that can happen as far as interventions, but for us as massage therapists, our approach should include focusing on relaxation and calming techniques. Again, just kind of err on the side of caution. If you're a reflexologist, you can use some of those tools if you feel so inclined. Make sure, of course, you get consent and that that's agreed to. But the therapist should create a calming environment. Avoid anything too strong or too, that could worsen the nausea, basically. This is something that should be covered during the intake always. Sometimes peppermint will actually help alleviate this. I saw a mama just yesterday where she wanted peppermint. She'd been using a lot of that at home as well. So just have a really good conversation. Again, communication is one of our core values, but HG is kind of interesting in how it can present per individual. So this is where, again, we default to, when in doubt, talk it out. Just have a really good conversation about how it's presenting, what she's doing to manage it, and what you can do to adjust your approach and the session around those needs. Okay, the fourth one we're going to discuss is placenta previa. Now, we all know what the placenta is, right? It's an organ that is created just during pregnancy, and it's inside the uterus with baby. But sometimes the placenta attaches at different places, right? Placenta previa is where it attaches in the front, or it attaches, not in the front, but it blocks the cervix. Placenta previa is where it blocks the cervix. So the approach is to avoid abdominal massage where you're going to be focusing on the uterus. I'm going to tell you that if you are experienced and confident with doing like a diaphragm release, or just doing some lighter work, like maybe releasing some round ligament pain, but staying kind of more lateral and like just kind of right inside the iliac crest, and kind of steering clear of any of the uterine attachments at the uterus more medially. If you're just a little bit boundaried in that way, that's fine in my experience. But placenta previa, you'll probably want to utilize side lying. That's another thing to consider. You basically want to have a focus of relieving tension in the back, neck, and shoulders without putting pressure on the pelvic area as much as you can. So some additional considerations. This condition involves potential risks for bleeding. So just always avoid areas where the placenta may be located. Like I said, like right at the uterus. But you can probably, depending on how big the belly is at that point, if mama's still kind of early on in the pregnancy, or maybe just, first or second trimester, or maybe early on in the third try. Again, everyone is so individual, but how she's presenting, sometimes you can do belly work, sometimes I would say err on the side of caution and not. This is going to be one where you're going to have good integrity as the provider. Think about what you feel you can authentically provide. You're not pushing your boundaries. You're staying within the scope of what you feel comfortable and confident offering. I will work the belly of a client with placenta previa, but again, I'm going to work around that cautionary site, that endangerment site. So, but others, I would encourage you to maybe educate mama, have a conversation. Again, when in doubt, talk it out, and just be aware of what placenta previa is. It's a condition where the placenta is blocking the birth canal, basically. The cervical opening is where the placenta decided to live. Now, sometimes, here's a fun fact. Sometimes, if this is caught early, the placenta will travel. There's a fun activity that I sometimes do where if you just visualize this for a moment, stay with me. You inflate a balloon just a little bit, so it's like a little bit inflated. And then by the air hole, you take a marker and you do a little dot. And then you continue to blow up the balloon. And the dot travels from near the opening to maybe like the middle of the balloon somewhere as it inflates. You get that visual of the dot kind of traveling with the inflation of the balloon? So think of that as placental placement. So sometimes as the uterus expands, that placental attachment site will shift a little bit. So that's cool to know about, and you can always follow up with mama about, has the placenta shifted at all, yada, yada, yada. Okay, again, it's just really good to know about. The fifth condition here is placental abruption. Now this is where there's been a bleed, okay? So avoid any pressure on the abdomen or lower back, and take extra care around the legs and pelvis. Light techniques, you want to aim for relaxation. You just want to default to more of a stress reduction kind of session here. So due to the potential for bleeding, it's crucial to avoid anything that could exacerbate symptoms like deep pressure. So that's the big concern there with placental abruption. Next one is ectopic pregnancy. Ectopic just means outside the uterus. So if there's an ectopic pregnancy, that's again something that needs to be handled and managed with their medical team. But for us, what we can do to help, we don't want to massage in cases of ectopic pregnancy until it's resolved, number one. So make sure that they get that resolved with their medical team. And then massage is contraindicated until the pregnancy is sort of stabilized and the risk is gone. So this is one area where you'll want to get that advisement from their medical team, their OB-GYN, CNM, whoever they're seeing for their primary care during pregnancy. And if a client has experienced or is experiencing an ectopic pregnancy, it's important to wait until that's cleared before you proceed. And then as you proceed, you don't need to treat them necessarily like they're made of glass, but you will again want to err on the side of caution. When in doubt, talk it out, have a good conversation about that and all of your good trauma-informed skills, really good listening, etc. Just listen to that experience that they just had with that ectopic pregnancy and just hold really good space. Keep that tether to them, right? You're not part of the wall. You're not like Freudian, not saying anything, but holding space is like you're neutral, positive, tethered. And keep that energy when you're listening to them share their experience and then how it's resolved. And then, okay, what brings you in today? How can I help you now? Right? Just kind of anchor it in, okay, thank you for sharing what you've been through. And now that you're here, how can I best serve you? What are your most important needs that you have and goals that you have? Number 7 is preterm labor. So preterm labor, this is, before 36 weeks is usually what I've read, that's what qualifies preterm. But there's all classes of that go back even more. But basically, if preterm labor is a concern, massage should be more gentle, just nothing too aggressive or too deep. The body can only handle so much change at a time. So just err on the side of caution there. Focus on more relaxing techniques, stress reduction. Upper back, neck, shoulders is always a great area. You should also avoid any abdominal or pelvic work and just keep it light, keep it grounding, and maybe default to more of a nervous system focus than a physical tissues focus session, except maybe a little bit of targeted work wherever they may be feeling that. Number 8, anemia, low iron. So this is going to present with a lot of fatigue, and not just fatigue like normal, like hormone fatigue. This is like the chemical firings in the specific muscle tissues and even down on a cellular level. Like they're not being given enough what they need to fire correctly. So this is a body system that is just not energized with anemia. So massage should focus on relaxation again and increasing circulation, because mamas who are very fatigued are probably not very active, right? So we should increase that circulation as much as possible, but gently. But you can help with that fatigue and avoid overly long sessions with anyone with anemia. This could actually exacerbate that fatigue. So just something to consider. You might also want to monitor your client a little bit if they ever get like woozy-doozy, dizzy, lightheadedness. Make sure you help them off the table or offer to help them off the table. I have somewhat of a sequencing for if I'm doing a prone supine session, a prenatal prone supine, using the body cushion. I have a little move. I'll have them rock back onto the lower half of the table to do some child's pose or tabletop as sort of a neutral passive position before having them turn. And every step of that, even like the way that I hold the drape so that they can turn, is very informed by what the body has going on, and understanding that an over-fatigued body and an under-nutriated body, just a really tired system, needs things to go slower, step by step, but you don't want to fuel the fatigue. You don't want to put them in a coma if they're already anemic necessarily. So just a few things to consider there. With anemia, they are dealing with fatigue that is beyond just the typical pregnancy fatigue. And they're probably taking something for it. They're probably taking iron supplements, or they're getting infusions. That's another method that's pretty common that I'm seeing kind of start to trend, actually, is infusion therapies, where you would go to an infusion center, or even some like birth centers are offering it now. It's kind of cool. But they hook you up to an IV, and they put not just a banana bag that's, a specific one, but they put a saline bag, whatever vitamins or nutrients are in there, to give you an infusion right to the source. And it can really help with things like anemia and other vitamin deficiencies or mineral deficiencies. Okay, number 9, certain infections that might help. So like, mastitis is one, an infection of a mammary gland, or like a UTI. There's different kinds of infections that can come up. So massage therapy is contraindicated if there's an active infection. Obviously, if it's something local, we can manage that a little differently. If it's a total or a systemic kind of infection, there's a total contraindication. So the therapist should obviously avoid any contact if signs of infection, or like fever or pain or tenderness, something like that, are present. Some other considerations to think about: if the infection is mild and it's not systemic, you can certainly still do a massage and just avoid that locally contraindicated area. But you'll probably, again, the principle, the body can only handle so much change at a time, you will probably want to err on the side of caution with that as well. So you can still do, a mostly full body session, but just keep in mind, how much change am I affecting to this system that's already going through so much change on top of fighting some kind of infection, right? So we want to be gentle, nurturing, kind of similarly to how we would approach a non-natal client who's maybe coming off of an infection, and they're no longer contagious or anything, but we still want to kind of nurture that system response, the immunity, kind of, okay, we're doing good again, let's go. So on the tail end of an infection is sometimes a great time to sort of nurture and stimulate some of these systemic functions. Like it can help. It can speed along the recovery, as long as it's not too much, right? So that's kind of a fine line that we as practitioners, we have to sense, and we have to walk that line. Okay, the last prenatal, I hate to even call this a pathology. It's not a pathology, but it is a condition that needs to be noted and talked about. So this is with multiples. Okay, so like with twins or triplets, etc. So again, it's not a pathology, but it is twice the work for the body. It's a lot of work, not just twice, but it's more work for this client's entire system. So we need to understand, again, we need to focus on things like relieving pressure and discomfort in areas of excessive weight, such as low back and hips. Things like belly bands can be extremely helpful, by the way. If there's hyperlordosis, I can't talk, hyperlordosis, the sway back, the big lordotic curve. But with using compressive things like a belly band, I always explain it like this: treat it like crutches if you roll your ankle. So you might need it to help you on the really tough days, or during the tough parts of the day, but ultimately we want your body to do the work. So walk it off kind of approach, but it's good to have crutches when you need them. It's good to have a belly band when you need it. I just don't want us to start encouraging clients to wear a belly band 24/7, because then that is training the body to handle the stresses and the pressures of pregnancy differently, and it can actually weaken those tissues that we need to be taut and firm and tight. That tightness, that tension plays an important role in how the body carries pregnancy. So it can be a helpful support, but we don't want to lean too heavily on it. So in a pregnancy where there are multiples, again, you want to focus on all of that postural tension. I would also defer to side lying. Again, that's going to go depending on how big mama is growing, how big the belly is, but also keeping things in mind like blood volume and blood pressure and, what is happening within the entire system, right? So I'm going to switch things up a little bit, but still, when in doubt, talk it out. Ask mama what would help her the most and give her options and let her pick. Inform her of her options. Give her education as to the benefits of side lying versus, laying prone. And depending on how big belly is, I would say you as the provider, you are the leader in that space, and you might make that executive decision. If mama walks in at week, let's say 20, and you know that she's carrying multiples, and at week 20 it looks like she's already in the third trimester, maybe put her in side lying at that point. It's never too soon. It's right when it's right for that individual. And this is what experience gives you. So this is why we're going to build this community, and you can always ask questions. You can always get that validation if you're not sure. But until you get that experience and you gain your confidence, you can ask or you can err on the side of caution. Okay, let's move along to postpartum. The first thing that I see, not very frequently, but it certainly happens, is postpartum hemorrhage, where either during birth of the baby or, the placenta, but during the birth experience, there was a lot of bleeding. It was a hemorrhage. It's when an artery breaks, and there's just a lot of bleeding. So it's very dangerous. And sometimes if mama hemorrhages, they'll keep her for observation a little longer, So by the time she comes to see you, there's been a lot of things that have happened. So again, I'm going to default to just say, have a really good trauma-informed conversation, have a really solid intake, have really amazing listening skills, really good reflective listening skills, and just holding that space, letting her process her birth story. And then again, just kind of, how can I best help you today? So things to keep in mind. After a hemorrhage, massage should only be done after mama is stable again. So just because she's home, from the hospital stay, or, the birth center stay, or wherever she was, make sure that she was cleared by the healthcare provider. That's number one. And you can help, again, with relaxation and stress relief, but avoid working on any areas directly affected either by surgery or blood loss. So just treat that entire area sort of as a cautionary site. You can still do lovely things, like I will sometimes still apply certain products, but again, I don't want to advise other therapists to do this, but I don't want to give the impression it's black and white. Most of the time, after a hemorrhage, by the time mama comes to see you, she's probably already cleared by her medical provider, but just know she's lost a lot of blood and she probably has some trauma from that experience, and you just want to give her relaxation and ease, and that should be the primary goal. And she may have some other targeting type goals, but you as the provider just know you can do some targeted work if that deeper work is actually going to help her relax and feel at ease. Like, for example, if she has been nursing and she has nursing neck, you can do deep pressure up there. It's okay. If she has a system that relaxes with that kind of pressure, then that's what that individual needs. And that's what she's asking for. And so that's what we want to deliver. But if there's still excessive bleeding or mama's still recovering, then definitely, have a good conversation where you're kind of educating her, positioning yourself as the leader in the space, and you're making an executive decision to delay the massage until her condition is stable. Postpartum depression is the next one. So very common postpartum depression. The next one we'll talk about is postpartum anxiety. But when we have clients who are experiencing postpartum depression or PPD, massage can be really effective. Massage can be beautiful in helping alleviate the physical symptoms associated with PPD, such as muscle tension and stress. So again, lots of gentle, soothing techniques. We want to promote relaxation, and that's going to help improve mood. It's going to help regulate some of those hormones. It's going to help overall. Communication with the client is definitely key here. Some women with PPD may be a little hypersensitized. Again, we're living in the land of all kinds of body transformations and potential loss of personal power as mama navigates all of these changes in her world. And so just having TIC, trauma-informed care, throughout is absolutely the baseline. That's just always there. And so because of that baseline, massage can be the perfect tool for things like PPD, can absolutely be the key to mama feeling safe again and feeling restored, even for a little bit. So massage and PPD are kind of made for each other. Postpartum anxiety, again, similar. You want to kind of keep it light. Some rhythmic motions. I like a lot of compression, as I call it. It's like compression with rocking. But slow, low vibrational techniques, rhythmic, lots of flow, that can really help with an anxious mind as well. And anxiety, oh my gosh, after childbirth, sometimes we see this during the nesting period as well too, but especially in the first year postpartum, anxiety can be pretty high. Some mamas that you see prenatally will tell you they have anxiety. And so it's important to chart that at that time, because then if it circles back again postpartum, it's good to have that pattern noted, you know. And you can also, when you're having your intake or you're having your conversations with the client, you can, in a very therapeutic, gentle way, refer back to, oh, well, I recall during this session you had mentioned that you were experiencing some anxiety at that time. Compared to then, is it more, or is it more overwhelming than it was? You know, like if you have a client where you've developed that rapport and you have sort of an ongoing relationship and you feel like it's appropriate to ask questions, again, not with every client, but some clients you will have that relationship and you can have a little more dialogue about it. But anxiety sometimes will heighten after childbirth, when mama is, you know, dealing with sleep deprivation and all kinds of things to manage, and her mind is just, you know, in a primally wired, tired and wired state, and her hormones are just, and all kinds of things are happening, right? She's riding this wave that she is just holding on for dear life. So we can come in and provide a somatic experience for her entire system to just feel safe and at ease. And that should be the goal with anything related to postpartum depression or anxiety. Next one to discuss for postpartum is other postpartum infections. I mentioned previously mastitis. Obviously with mastitis, we're talking about breast tissue. We would not be massaging breast tissue, but even like doing pec work or even like anything up here, you know, there's just, it's a whole cautionary sight. And sometimes things that help mastitis are heat. I have this heated weighted pillow that's shaped like a heart. It's a brand called Mother Earth pillows, and I love Mother Earth pillows. They're flaxseed stuffed. They're one of these. So I keep it in the hot towel cabbie, and it's the perfect shape and size to go over the breasts, or if I have a mama who's on her period or postpartum, no mastitis, but maybe postpartum, I'll place it a little lower on the abdomen. Providing heat postpartum can be incredibly beneficial, and a lot of cultures around the world have postpartum rituals that incorporate heat into things like diet and movement. And you know, you want the body to have let me put it this way, while pregnant, the body kind of goes into oven mode a little bit. And then after baby is born, that body has lost a lot of its heat, if you want to think of it that way. And so heat, putting it back in a postpartum body can be extremely restorative. But on mastitis, it'll just feel like sweet relief to those tender, swollen areas. There are other things, you know, in the realm of mastitis, but I'm not going to get into that right now. But there are lactation consultants as well. That is another provider type that you can have a referral base. You can refer to other IBCLCs, lactation consultants. Let's see. Okay, what about surgical sites or wound infections? That would be a local contraindication. That would be a cautionary site, or not a cautionary site, a contraindicated site. So we wouldn't want to massage over that area directly. And sometimes even if mama, for example, has a C-section, so she has a scar in the lower abdomen, and sometimes I've seen these C-section scars, they're like right above the pubis. They're like really, really low these days, some of these C-section incision sites. So I would ask during the intake about, if you're planning on doing a prone session, how they feel about laying face down. If that's going to be comfortable for them, if it's going to be too difficult for them, even like rolling from face down to face up, if that's going to be too much. I've never experienced it where mama said no to that, or once she got on the table and then I, you know, came back in to begin the session, I asked her, okay, how does the cushion feel? And every time I've heard that it's good. And I've worked on mamas within the first week after delivery. So everyone's different though. That's why, again, when in doubt, talk it out. So just ask, give them a choice, let them choose. That's also empowering to them, by the way. So much of this stuff is really, it comes down to communication, if you haven't already picked up on that. But again, with infections, we treat locally contraindicated areas, but you can pretty much do everything else around that. Just take into account how much their overall system already has taken on. Other infections, I didn't mention this, but like endometritis. Oh, what am I saying? Endometritis. There are all kinds of infections. It doesn't really matter that we go down each little one. And again, this is one of those things, our job is not to memorize every single pathology that exists. There are common ones that come up, and as they come up, you'll collect data points, if you want to think of it that way. You'll have your experience, each experience with a mama who has a particular pathology or condition is like a data point for you. So as you collect your data points and gather your experience, you'll feel more confident and you'll feel more knowledgeable. But I don't want anybody listening to this to get too hung up. I mean, I just kind of fumbled through pronouncing one of our infections. So I don't want you to be thinking, I have to have all this pressure on myself to know all of this stuff. I want you to know a little bit, know enough, but don't put all that pressure on yourself to suddenly feel like you have to know all of the things in order to work or help a client. At the end of the day, like I keep reiterating, when in doubt, talk it out. Ask this person about their condition, how it's presenting for them, and kind of go from there. Okay, the next couple, number 5 here with postpartum is breastfeeding complications. So all kinds of things that happen there. And little different from mastitis. Mastitis is an infection of a gland, a duct. But there are also, there's engorgement, there's cracked nipples. It's very painful, and breastfeeding can be an extremely, extremely emotional experience for a lot of mamas. So just a couple of strict things to know when it comes to breastfeeding complications. Obviously, we'll avoid the breast area, the chest area even, like I would avoid the pecs when massaging around a shoulder. Err on the side of caution as you're swooping around the shoulder to not get too far into the axillary. And some mamas a PT friend of mine, a pelvic floor PT friend of mine told me this. Some mamas actually develop mammary glands like into the axillary. I did not know that, but I guess that's a thing. So just again, err on the side of caution when working more into the armpit area. Next one is DVT, deep vein thrombosis. So during pregnancy as well, cautionary sites include the lower extremities, so below the knees. And there's a lot of swelling that can happen, in the lower extremities. We can do lovely, light, Swedish, lymphatic, that's wonderful, amazing work, but we don't want to do anything too deep on the lower extremities, either during pregnancy or postpartum. I always say up to 6 months. I err on the side of 6 months. I might be erring too much on the side of that caution, but I always just mentally, if a mama's within 6 months of having given birth, regardless of delivery method, I always treat the lower extremities as if it's a bit of a cautionary site. Now, I will go to town on the feet, but the calves, and calf cramping is a common complaint during pregnancy, and so stretching the calves is all good. You can stretch, you can do some things like as the Achilles wraps around and becomes part of the plantar fascia, you can really have fun with the feet. But as far as everything like the gastroc and the soleus, don't do any deep stripping or friction moves. Just always be aware of that contraindication of DVTs. Number 7 is urinary incontinence. So for this, we want to use an approach where we want to relieve pelvic floor tension, improve circulation in the pelvic area using very gentle techniques. I like to do hip pedaling. This is like kitty paws or pedaling when I kind of mobilize it kind of like in a figure 8 or circles, call it pedaling. So something like that at the hips can be really nice. But we don't want to do any, like I said, like deeper, more pressure-y kind of work on the abdomen or the pelvic area. Let's see. Pelvic floor disorders. It's another really good provider type to have in your referral network is some pelvic floor PTs. Pelvic floor physical therapists are so amazing for women going through pregnancy or recovering afterwards. And pelvic floor disorders, there's a lot of different pelvic kinds of pain that can present, and we have a license to touch, so there are some things that we can do to help through external manipulations and work, but pelvic floor PTs can do internal work, and sometimes that is helpful when we're trying to assess or palpate. Like sometimes you just need somebody with that scope of practice and that knowledge base. They're also going to much of the time help them with exercising in the recovery part. So they're retraining through a lot of proprioception and a lot of repetitive movement and breath, and it's retraining the nervous system with the body, and a lot of that has to do with the bladder. They can also put in, I forget what they're called. It's like a buttress. It goes in, I believe, intravaginally. I could be wrong. Again, this is outside my scope of practice, but a pessary. Is that it? We'll come back to that. I think it's called a pessary, but it supports the bladder. It quite literally lifts the bladder, and helps the bladder kind of recover in and of itself. But there's all kinds of things that happen within the pelvic floor and all kinds of disorders. So just always talk it out with the client, ask them about any specific things that might help them or any specific restrictions, but they're going to have different sensitivities with pelvic floor pain and disorders. It could be pain during sex, pain during peeing or pooping, just urinating a lot, the classic, like you sneeze and you pee, and need to regain strength in the pelvic floor. This is the world that pelvic floor PTs live and are amazing in. So this is why it's really, really helpful if you have a mom complaining of any of these things. You can ask her if she's pursued or looked into pelvic floor PT, or you can refer some providers for her. The final one I wanted to bring up is just lactation failure. This happens. It's all kinds of reasons. I won't start going down that rabbit hole, but I have so many mamas who have different stories when their milk comes in or doesn't come in, or baby will latch or baby doesn't latch, or baby, something happened with baby and so baby was in the NICU, and mom, they weren't able to have their breastfeeding experience the way that they were hoping and intending, and things happen all the time, and lactation failure is extremely common. And I empathize with these mamas for how heartbreaking that can be. And so, again, it's good to have a provider referral network for IBCLCs, for providers who are experts in that area, and also mental health providers who specialize in working with moms, and the journey of matrescence, as it's known, the journey of becoming a mother, and all of the identity things that go into that, all of the things that go into that. And it helps to have other providers that you can, refer your client to. But for you, just be mindful of the emotional toll that can take and that can have on mom. And it can make her feel all kinds of ways. So we just want to create a really supportive, nurturing environment. And it's important, especially with something like this, that we don't start talking about our experience, right? We just hold that space. We use all of our beautiful communication skills and our non-technical skills, really. It's like our non-massage skills. It really just comes down to how attuned are we? How aware are we? And it's more about what we don't say than what we say. So, to wrap it all up, some general considerations for all clients. Positioning, body positioning. So for pregnant and postpartum clients, whether you're utilizing a body cushion like I do in clinic and you want to have them safely prone and semi-reclined when they're supine, or you want to utilize side lying and semi-reclined, or some combination of all of these things. I mean, there's really no wrong way to do it necessarily. It's just what's right for this individual at this time, on this day. But you want to just make sure you have enough bolsters, pillows, just extra comfort. That's kind of the foundational rule there. Communication, I've mentioned this more than a few times in this video, but just always check in with the client to ensure they're comfortable, and just monitor for any signs of discomfort or any adverse reactions. But as I talk about in my trauma-informed bit, sometimes that's just the body discharging stress. If they're fidgeting or if they're whatever, it's not necessarily a sign of discomfort. So as you get to know your clients, or you can check in and ask, but much of the time, if we're nervous system attuned and we're kind of focusing on their nervous systems, any little bit of fidgetiness or wiggle wormness, sometimes that's a good thing, and we don't want to even mess with that. Just let it flow. Flow with the way that their system needs to discharge that energy. And nothing's wrong. You're not doing anything wrong. You need to stay appropriately boundaried internally and know that it's not you, right? Just go with it. Just go with it. Just flow with it. But if they are clearly in distress, obviously you'll want to change something and put them at ease. You can also, depending on what is presenting in this mama, you can absolutely consult with their other healthcare providers. So it's crucial for you to communicate with permission, with consent, of course, when there are significant complications or pathologies involved. So when in doubt, talk it out. That doesn't just mean with the client or the patient. It means talk to other care providers, get their insights, get their feedback. I've talked to so many PTs, chiropractors, MDs, like different folks in their care team, right? You can talk to their doula, you can talk to their, like, don't be afraid to reach out if you feel so inclined. I think it shows that you care. I think it shows integrity and professionalism. So I have yet to have that be questioned. If I'm like, I would love to talk to so-and-so about this a little more. How do you feel about that? Oh, sure, here's their number. Like, every time. I've never once ran into a case where there was any objection. And again, I think it's a good practice to have, to be open to making sure you gather all of the information that you feel you need as the provider before proceeding. So by adjusting your techniques, your pressure, the session length, the flow, all of the stylistic elements, I mean, there's so many things that we can adjust and you know, stay flexible with. We as massage therapists can help address all kinds of discomfort. We can promote relaxation and ease, not just in the body, in the mind, and the nervous system, in the entire system, and support healing because of that. So not just during pregnancy, postpartum, but beyond. So thank you so much for listening, and